Good afternoon. My name is Dr. Erica Wheeler. I am the country representative for PAHO and WHO for Trinidad and Tobago and the 6 Dutch Caribbean entities. Why the need for community testing? Well, as you know, both at Christmas and before Carnival, there would be large gatherings of people. And it's really important to get an understanding of the spread of COVID-19. Although we know that we are using much more home tests, it is still important to understand how many people would have tested positive as a result of gathering, especially indoors in large numbers. So let's just have a quick run through of the types of figures that we saw. So around Christmas time, there were 246 cases that were recorded. But as we moved later on in January and leading up to Carnival, where of course more people would be coming into the country, we saw an increase in the number of cases. There were 559 cases. So this really reflects the fact that COVID is here with us, the fact that we had persons coming in, friends and family, tourists for Carnival, and you would expect in this situation to see a spike in the numbers, although they are not as high as they could have been, which indicates there's a certain level of immunity in the population, both from vaccination and probably having had COVID. So it was important for us as PAHO to get an indication of the prevalence of COVID, even though it might be a relatively small number. And people were also happy to have a test that they didn't have to pay for.
The PAHO Trinidad and Tobago Country Office was one of 2 Caribbean countries that received funding from FINE, which is a global non-profit organization who seeks to ensure that there is access to quality rapid diagnostic testing. We were very privileged, and therefore we set out to organize this community rapid antigen test project. We quickly engaged key and strategic partners with whom we were involved in other activities previously. One of the principal partners that we engage with is the Caribbean Med Labs Foundation.
Well, this project is really important because we know that there's been a lot of interaction during the Carnival season, and so PAHO requested Caribbean Med Labs Foundation to assist in coordinating an initiative to test the community, out in the community, to see the level of transmission that we're actually seeing post-Carnival.
They were responsible for the testing aspect of it and quality assurance. So they were critical in supporting that promotion and decentralization of rapid testing. Another critical partner was the Archdiocese ministry responsible for migrants and refugees.
I am the community outreach coordinator, so I'm responsible for the site setup, the logistics, and just getting site approvals and that kind of thing, data entry, data management. We are quite familiar with doing these community outreaches, and that's something we specialize in for both the migrants community within our parishes where we operate. So yeah.
They were critical to the process of logistics, whereby they conducted site visits to be able to establish the site for testing. They were also involved in the distribution of flyers and engaging persons who wanted to get testing, as well as they played a critical role in the registration, acquiring data for those who were participating. The third and critical partnership that was involved in this community rapid antigen testing project was the Medical Research Foundation of Trinidad and Tobago.
The role of my agency is very critical. We have trained healthcare professionals, along with myself, to address the medical needs of those persons who are most at risk, those persons with medical comorbidities and who suffer the most when they get contracted with COVID-19. We want to allay your fears, answer your questions about your health conditions, and again, what this will do is help drive their intention and increase their confidence in taking the test.
The threat of COVID-19 still remains a public health concern today. It is envisioned that we will have to live with COVID-19 like we've lived with other viruses, including influenza. I am Dr. Paul Edwards.
I am Dr. Erica Wheeler.
The time to test is now.
And the time to test is now.